Hi, everyone. This is Martin Patella for Life Enthusiast Health Shots podcast. And today you will get a treat. Dr. Jennifer Pfleghaar, DO, Doctor of Osteopathy. I've met Dr. Pfleghaar over her summit that she created for thyroid and Hashimoto's and health of that sort. But that's in the past. Today, Dr. Pfleghaar is really into the research of the perimenopause, and we'll spend some time talking about that. And she knows a lot about female health, not just because she's a woman, but because she really knows. Welcome, Jen. Well, welcome.
Hi, thank you, Martin. Thanks for the intro.
Yeah, it's good to have you here. I think it's wonderful. Most of our audience, hi girls, are female, and they are all heading either into it or out of it, the perimenopause. Let's talk about that. What's that feel like, huh?
Right. It's a journey, and it's pretty amazing. About 8 million women in the United States are going through perimenopause, and there's, even more than that in menopause, almost 70 million. So it's a lot of women. And what I noticed in my private practice of integrative medicine over the last decade, the patient population I was seeing was perimenopausal women for the most part. They're the ones that are going through these changes, and they're not in menopause yet. They're perimenopause, which is before menopause. So they go to their doctors because they're in their 30s and their 40s, and they're kind of just getting gaslit. They're given prescription, many times antidepressants, birth control pills to cover up the symptoms instead of getting to balance the body, fix the diet, get insulin resistance better, do all the things that would improve their health and improve their transition to menopause. And sometimes it includes supplements. Sometimes it includes a little bit of progesterone. So it's very important for women to know that their body isn't failing them, first of all, that this is a transition, and it's a transition that can go a lot smoother.
Yeah. Interesting piece of statistics. 25% of women are actually taking antidepressants. And interestingly, women who are on the birth control pills are the best candidate for antidepressants. You probably know the statistics from your research, right?
Yeah, I think what's crazy about this is actually when I was in high school, I had been put on birth control to regulate my period. I was going through thyroid problems, and I had a thyroid nodule, which then we found out, a decade later, that it was Hashimoto's. And I was prescribed birth control. And then right after that, I got really bad PMS symptoms, and I was actually PMDD, and then they put me on an antidepressant, even though all of this was caused by the birth control. And and what happens with that is some doctors will tell patients that birth control is just, it's hormones. No, it's synthetic hormones, synthetic chemicals that are honestly, they're endocrine disruptors, and they cause damage. And to your point of saying that these women on birth control are then prescribed antidepressants because it's a side effect from the birth control, really.
And so there you are in your 20s and dysregulated, over estrogenized, and PMSing and bloating and having all of this stuff, and you're wondering why that is. And it could be because you're taking too much estrogen.
Yeah. So in perimenopause, we are having this decline of progesterone. So
Mm-hmm.
progesterone peaks during the second half of the cycle. So a lot of women, they get the bad PMS the week before their cycle. A lot of times that is a lack of progesterone, which is a calming hormone, which makes us just want to curl up and watch a movie, and stay in. And
Mm-hmm.
to not be feeling erratic or irritated. That usually indicates estrogen dominance. And that term means that your estrogen is out of balance to your progesterone. Okay. And what
Right.
happens is that gap can widen further because in our environment, we have, I spoke about endocrine disruptors. So we have things that act like estrogen, like plastics and fragrance and phthalates. So we have that problem. So we're seeing women in their 20s with estrogen dominant symptoms.
Right.
But
Right.
in,
And there you have it. Difficulty to go to sleep,
yeah.
lack of stability, feeling unstable, feeling weepy, feeling
Mhm.
over emotional. All of that is actually the decline of the progesterone as it starts going downhill.
Yeah. Yeah. So then these women in perimenopause, some of them haven't really had those symptoms before because they were pretty balanced, but then that progesterone starts declining. And then what does estradiol do? Well, estradiol is pretty erratic during perimenopause. Overall, it's declining, but you'll get these really erratic, like double spikes of estradiol. And why is this? Because our follicles or our eggs coming in, some of them just aren't as high quality as when we were in our younger years. So then the body kind of overcompensates, and FSH is a little signaling hormone that says, hey, we need another follicle here. It's time to ovulate. So it actually pushes out a little bit of more estradiol. And this is where we get these irregular cycles, or maybe they're a little longer. But usually we see the progesterone declining, cycles start to get shorter. Okay. So instead of 28 days, they start to be 27, 26, 25, because that progesterone's going down and you're not replacing it. And then we also get more of the PMS symptoms. So we get heavier cycles,
Mm-hmm.
cramps, breast tenderness. And then, as you were saying, difficulty sleeping, anxiety is big, more depression, more irritable with their kids. And that's what I noticed. During that late luteal phase, I was never really agitated with my kids, or I wasn't irritable, but I would like snap. It would always be that week. And I'm like, oh yeah, I'm starting perimenopause. So you can try, chase tree berry to kind of stimulate your own body's progesterone production. Or you can do a nice luteal phase, day 14 to 28, oral progesterone, or you could do topical progesterone
Yeah.
too, depending on your sleep.
Yeah.
But yeah, I mean, there have been so many women that have come to me and they are just struggling, and that just gives them relief sometimes to
Right.
just replace that progesterone and even that out. And you just are taking it, you're mimicking your natural cycle where you have that progesterone during that second half, that luteal phase.
Yeah.
But yeah, it's really hard on women because when they go to their doctor and they're given birth control, that is just masking the symptoms. Plus, as you were saying, it's like extra estrogen, because
Mm-hmm.
synthetic estrogen that binds so tight, it's conjugated equine estrogen. It binds tight to those receptors, but it activates them differently, and it's not protective like we want it to be. So then what happens is some of these women have been on birth control. I'm sure you've seen this, from their 40s to their 60s, and they don't even know when they've been through menopause, and that's terrifying to me. So there's a lot of issues right now with women's healthcare and perimenopause, in my opinion.
Yeah. Well, the thing that sets me off is we have these estrogenics, right? Either xenoestrogens or phytoestrogens. And the thing that I work with nutrition mainly, and so it's the phytoestrogens. And you probably know this: seeds, nuts, and even grains are all protected by this hormonal protection, and it's pushing the estrogen level up.
Mm-hmm.
So if you're drinking seed milks, like, I don't know, oat milk, or I don't know, almond milk would be a good example,
Mm-hmm.
you're actually artificially pushing the seed level and the phytoestrogen with it. Have you run into that?
Yeah, well, so it's tough because I think that it depends on what you're taking and how, right? So I think some like ground up flax seeds during the follicular phase will actually support the estrogen, okay, and that's
Mhm.
okay.
Yeah.
Soy, if you're having soy that's like GMO crops, highly processed, that's going to be more a negative effect. And I know they've done a lot of studies that soy doesn't really affect like growing children and stuff like that, but here's my thing. We were not supposed to milk soybeans for milk. Like that's not how God intended it. We could have some edamame or something like that, but were we supposed to consume textured soy products and all that? No. And I know some cases, some patients I've had that they were vegan and they were just consuming soy, textured soy, all of that, which they were getting kidney stones from the processed textured soy because that's high oxalates. But I mean, if you take it to that level and you're not having a balanced diet, then yes, that can push the needle, away from health and more estrogenic. Yeah, so like soy milk and all of that, like it's just not a natural thing. We are getting away from. I'm a more proponent of, just eating more animal based. So how we're supposed to in whole foods based. So
Yeah.
I had a really good raw milk farmer in Ohio, and I need to find one in Tennessee if anyone has suggestions. But that has everything intact. When we're looking at our food now, it's just more and more processed. So then if it's more processed, yes, people are then going to develop more food allergies to them. And then that pushes them to those seed milks like you were talking about.
Yeah. Well, actually, I would like to just lean in on your expertise about the thyroid because
Mhm.
that is very much and very often an indicator or tied into hormonal dysregulation, right?
Yeah, absolutely. The thyroid is tough because everyone's an expert on social media. And I just had someone reach out to me and they're like, oh, if I fix my autoimmune disease, can I just get off all my thyroid medicine? And I'm like, not all the time, because if your thyroid tissue is actually damaged, it's not just going to revive itself automatically for you giving up gluten, right? So when we look at the thyroid, it is an endocrine organ and it is more susceptible to environmental damage, like environmental toxins, mercury, perachlorines, like all of these nasty things, pesticides, all of that we have. So as we age, I do see thyroid function decline sometimes. And sometimes we give supplements to support the thyroid. I love thyroid bioregulators because that actually helps the tissue kind of tap into that biological reserve. Professor Cavinson did a lot of study with bioregulators, so I've seen
Mhm.
that help. But to say that, we can like we can reverse disease, but sometimes the thyroid is just too damaged. It's not like our liver, where I've had patients with fatty liver totally, regenerate their liver and do great. It's just a different organ. So in my experience and expertise, yes, sometimes we can reduce the thyroid medication, we can reverse the Hashimoto's or Graves', but sometimes the damage has been done. So the best thing you want to do is, if you notice something's off with your metabolism, your energy, your cycles, your hair, your skin, get a full thyroid panel. So that would be TSH, free T4, free T3, reverse T3, TPO antibodies, thyroglobulin antibodies. If there's a Graves issue, then you want to get the
Yeah.
Graves antibodies. And
Right.
then if you have an autoimmune disease, your gut is on fire, something's going on, and you need to reverse that before more damage is done. And then that is the point where, yes, possibly you can, get off all the medications or something if you have
Right.
it. Yeah. So then thyroid plays with the adrenal glands and plays with hormones too, right? So if our adrenal glands are very stressed, acute stress, chronic stress, it can start to like put some pressure on the thyroid and affect the thyroid levels. I see that a lot.
Mhm.
And then, also we have our ovaries over there, where if our thyroid is hypothyroidism, which is most common, that is going to affect not only our menstrual cycles, but our fertility. So I see that a lot with
Yeah.
women.
Right.
Yeah, if they're very hypothyroid, that free T4 is very low. Your body's in like reserve mode. It's trying to,
Yeah.
conserve all the energy, your body is not going to be like, oh, it's a great time to get pregnant right now. So that has to be optimal too. It's tricky, right? I mean, fertility is a vital sign of a female's health, a regular cycle, and I guess, okay, so I'm just getting so passionate about this. And this is why I'm so mad that women are just thrown on birth control. That is like saying to a doctor, like in the ER, which I'm an ER doctor also, like, well, we can't get blood pressures on your patients all day today. You will have to check them out a different way. No blood pressure, no heart rate. And we would all be like, wait, what? Those are vital signs. Like, we need them. Well, if you're taking away a woman's menstrual cycle, that's like a vital sign of their overall health of their body. And it's the one thing every patient appointment I have, I always ask them about their cycle, unless they're in menopause. But every menstruating woman, it's like a big indicator of what's going on in their health to me.
Yeah. I have found, well, there's a science to support it. Iodine is really interesting because it also is involved in the strength and health of the mucosal barriers. And so you're talking about gut health decline and whatever. I mean, you will also notice it in the strength of your vaginal tissues, as in more resilience when you actually have more iodine on board.
Yeah.
And that's what.
And I always call iodine, I don't know about you, but I call it like the Goldilocks, right? Because it can't be too high and it can't be too low, and it has to be just right. And it's really hard to test sometimes. So, you have to make sure you are getting it in the diet. It's important for thyroid health. And unfortunately, a lot of environmental things like bromide in bread at Subway and chlorine can displace, iodine where it needs to be. So we also, once again, environmental factors really play a significant role in our hormonal health.
Yeah. Now you mentioned bromide, of course, the tragedy of the American industrial bakeries. They used to use iodine to condition fast processing of dough, but they switched to bromide.
Why? I wonder why. I don't know that history.
I don't know why they did it, but they did do it. And so the iodine use declined and people didn't notice, but illness went up. Yeah. Interestingly enough, I use, I tell people, well, raise your iodine, see how you feel, especially around your menstrual issues. And of course, not enough iodine, greater chance of losing your pregnancy. Not enough iodine, greater or lesser chance of getting pregnant. All of that's tied in there.
Yeah.
I wanted to point out, I wonder if that was in your school where you can test for whether you have or don't have enough iodine with just morning temperature. If you're too cold, like 98.6 is the Goldilocks, and anything below that, you're not getting enough.
Yeah, I haven't gotten that in the school. That was more thyroid related, but it would correlate technically with the thyroid.
Yeah, you need enough iodine on board to make sure that the thyroid's doing its job.
For the thyroid, yeah.
And of course, then there's the liver, because the liver is where the T4 to T3 conversion takes place, right? So.
Yeah. Oh, this is a really interesting case study. So I had a patient that I saw that had been really stable on her thyroid medications, and then she had her dermatologist put her on a medication for her hair. My patient just wanted to do this. I'm like, but this was very hard on the liver, this medication. And there were like, I looked it up because I don't prescribe it. I don't prescribe too many medications, but this biologic was very hard on the liver, and it affected her thyroid levels. And I'm like, but it affected her T3.
Right,
So
T4 to T3 conversion declined.
Yep. Her T3 was coming down, and I'm like, this is so interesting because your deiodinases, which take an iodine off T4 to make it T3, which T3 is the active thyroid hormone that binds and does the work. And I'm like, that's interesting because I bet you that is what's happening. Your liver is being so stressed out by this medication that you are getting poor conversion now. And before, she had never had a problem. Like it was very interesting to see that in real time. And I'm like, oh, these doctors prescribing all of these medications and messing up my stuff that I have going on for my patients.
Right. Well, the other one you notice is if you have thermal regulation issues, hot flashes,
Mm-hmm.
9 times out of 10, it's the liver that's fix the liver and hot flashes go away.
Yeah. Yeah. That and stress too. I have found out a lot of women, they will say my hot flashes are back and my estrogen must be low. We do a saliva hormone test for their estradiol and their estrogens. They are perfect. And I'm like, it's most likely stress, not hot flashes are not only caused by low estrogen, even though, I mean, this is kind of what's ingrained in women's minds because there's a bunch of drug companies that have a drug for hot flashes. So that's kind of what they go to. But,
Yeah,
but I would say stress. What? Like what?
yeah, the classic. Your headache was caused by the deficiency of excedrin.
Yes. Yeah. Or PMS might all makes it all go away. We all grew up with that.
Oh my lord.
And this is just the normalization of symptoms, right? And I try to explain this to patients, like they sell more pads, more tampons, just like women with pelvic floor problems, postmenopausal from lack of estradiol down there, or they never got pelvic floor therapy after having a baby, which every woman should go through. But I mean, Depends is like a multi million-dollar industry. I was looking it up one day, going down a rabbit hole, because I'm like, I can't tell you how many patients that have had babies that I see that are women that have never gotten recommended pelvic floor therapy by the OB-GYNs that delivered their babies. And I'm like, this should be illegal. Like, I don't know. It's just not okay. But if a woman needs a bladder sling, that's more money for, the hospitals. Depends. UTIs for, all of that. That's just more sick care money rolling in. So this is where I just like to inform women that no, symptoms are not normal. There's a way to fix it, and there's a way for your body to go back in homeostasis the way God intended.
Could you describe the pelvic floor therapy? Like, what does that involve?
Oh, yeah. Yeah. So I went through pelvic floor therapy after having my first son, and I had really big babies. My husband is 6'4". My last baby was 10 pounds, 10 ounces. They like reweighed him like a bunch of times because they couldn't believe it, because it was an unmedicated birth and it was just so nice. Like, I don't know. I loved being pregnant. I loved childbirth. But what happens is, so imagine carrying with your hands, like, when you bring the groceries in, like 20 bags at once, and just imagine holding those bags up like that for 5 months, right? You're going to get like trigger points in there. You're going to get muscle strain, sore muscles, all of that. So that's the pelvic floor, right? It's like holding a baby for all that time and barely getting to relax. Plus you have all these you have muscles connecting the different pelvis, floor wall, and then you have sphincters and bladder and everything. So me personally, I had this weird hip pain that wouldn't go away. Like I was just having like my right hip hurt, and I went for a consult for the pelvic floor therapy. And one thing that's really important is to get someone that does an internal exam and internal trigger points, and they can feel and palpate with their fingers if there's a tight trigger point in there that needs like a little bit of pressure to loosen, because that can cause trigger point pain, which sends referred pain. And mine was going to my hip. It was like deep hip pain. So I've had a lot of patients that have had similar things. And then just like a muscle, like how you do bicep curls, you need to make sure you are contracting and relaxing your pelvic floor muscles properly. Because if you're not, then that's going to set up more trigger points. That's going to cause some women have like hyper like activity of those muscles, or like hypertone. If the tone's too tight and they don't relax, and then that can cause all sorts of things, back pain, posture issues. A lot of women that have like a kind of like that poochy like stomach in the front, sometimes that's due to diastasis, sometimes that's due to too much tone in certain places. And that's all like you need to have be evaluated by a pelvic floor therapist. Because like I said, that could cause like the low back pain, UTIs, pelvic floor leaking, of urine leaking, constipation, and none of that is normal. And as women, especially going through hormone changes, childbirth, like we really do deserve to have everything working properly and go back to normal. And it definitely can. So I went through, pelvic floor therapy personally with my first and second. My third pregnancy, I just did stuff on my own because I kind of knew what to do. But yeah, definitely, even if, your listeners are out there and they're 60 and they've had a baby and they didn't have pelvic floor therapy, I would recommend them go get an evaluation. Like I refer like my patients any age, if they've never gone to a therapist, pelvic floor therapist, I have them go.
So is it like a specialized massage therapy?
No, they're physical therapists, and not all of them do an internal exam and know about trigger points. So that's why I just say make sure they do an internal exam too, because it would be like I don't know, it would like be going to a car mechanic and he just looked at the outside of the car. He didn't open up the hood at all. You're not getting all the information and all the feedback. So
Right.
that's
No,
why.
I got that.
Mhm.
Yep. You need to be willing to get examined and tested from within.
Yeah. Yeah. And, it's just, we shouldn't be embarrassed about talking about it either. Because I've seen lots of healing from women, paying attention to their pelvic floor.
Yeah.
And then also, same with hormones. Many women in perimenopause go to their doctor and ask to get blood work, and they say, I don't do that, or it's not going to show anything. And that's when you can fire that doctor. You can keep that doctor because usually it's an insurance, coverage, conventional medicine, and then go see a functional or integrative doctor that can prescribe hormones and then do advanced testing. So that's a lot of the people that see me. They have gone through traditional medicine and then they come to me and we really just wrap everything together and do advanced testing.
Yeah. Yeah, I would expect that taking the find me the cause rather than throw me a pill would be a better approach.
Yeah, but as you know, like what you do, patients and clients have to be motivated because it does go both ways. I mean, we can only tell people about their body or how to help it, but they have to, take part in it, changing their diet, maybe taking supplements, maybe taking a walk outside and grounding and de-stressing. So I tell my patients that they're the ones that are doing the work, the actual work for change.
Logically. So have you put all of that into the book?
Yeah, yes. So the book, I am pretty convinced that if someone is struggling and they pick up the book and read it through, and there's also a guide as a free gift with the book, and I think women could get 80 to 90% better. I mean, I think, or that many percentage of women could get relief from just what's in the book. And then maybe a few would have to go on and get, if you need prescriptions or advanced testing. But yeah, I talk about even how environmental toxins like mold and mycotoxins can affect women's hormones, because I see that a lot. And it goes back to the liver, where mycotoxins clog up the liver, that's clogging up the hormone cascade and factory that gets rid of our estrogen. So it's very it's very detailed, but it should be an easy read for women out there that are struggling, and relatable, because I share my health journey and experiences as a doctor and my patients' experiences.
Right. Yeah. I just keep struggling with the not going back and just saying, please just go see an integrative. Don't bother with the medical approach. It's not going to get you much.
Yeah, but at the same time, I welcome second, third opinions. I welcome a conventional medicine doctor's viewpoint, because I mean, I'm still a conventional medicine doctor, and I think they're very good for just for routine testings and use that insurance, right? And
Sure.
I say it's like car insurance, right? Like if you can get something through your car insurance, that's fine, right? Like if you get into an accident or need the emergency room, but for your oil change, for filling up with gas, keeping your windshield wiper fluid, full, that insurance doesn't pay for. So those
Hmm.
are the things that you need to put money aside and just really make sure that you can take care of yourself, because I don't know, it's not the doctor's fault. Like I really do I don't think the doctor that you are frustrated with is a bad person. I think that they are jaded by their medical school education, and now they're trapped in this model of pushing people through and seeing 10 to 20 patients a
Yeah.
day, where they don't have time to learn. They're exhausted when they get home. They don't want to know new treatments. They don't want to know new research. They don't even want to look for patterns. They just want to get through the day. So it's sad.
I'm actually, sorry.
Yeah,
I'm actually blaming the insurance companies because they are
exactly.
pushing the standard of care, and there you are. You don't get
Yeah.
paid if you don't do what they're telling you to do. So yeah, you become a mechanic.
Oh, it's criminal. Oh my goodness. And I've had patients that, I don't think that just mammograms make sense anymore, where we're in 2025 and there's things like QT scans, which are FDA approved for breast screening. I've had patients in tears because all they want to get is an ultrasound and then a thermogram and use that information on their breast health. And they are getting refused ultrasounds unless they get a mammogram. It's like forcing procedures, and they know they have dense breasts. They know the mammogram always comes back inconclusive. I mean, the stuff that's going on behind the scenes in medicine is wild. And I've tried to call to speak with radiologists to educate them, to fight for my patients, and they do not even want to talk to a physician. That is like, I don't know. I've gotten really mad. They know my name because I'm like, oh, I have an order for an ultrasound and you're refusing to do this. Like I'm ordering an ultrasound on my patient and you're refusing. And they're like, yeah, our medical director won't do it unless they get a mammogram. And I'm like, shouldn't that be illegal? Isn't that like forcing procedures on people? But yeah,
Hmm.
they get away with
Yeah,
it.
yeah.
Yeah.
You cannot get this meal without the extra bottle of Coke. Mm-mm,
Yes.
can't do
Yeah.
it.
Yeah, it's really backwards, but I think the good thing is your listeners, they're here, they're hungry for more information. I think that it's like social media, while sometimes there's really bad advice on there, there's still a lot of good, and a lot of people like banding together and look at what's happening with the movement with getting rid of food dyes, and hopefully seed oils is next. I heard like Texas, I think, is making restaurants say if they have seed oils and stuff in them. So
Right.
I think that people are definitely like waking up.
You're hitting the big picture notes. How do we get the subsidy from the agriculture? How do we get the subsidy away from growing these seeds that are pushing us into overly, over seedly and over carby and over wrong
Yeah.
oils and all of that, right?
Yeah. That omega-3 to omega-6 ratio,
Yeah,
totally
that.
bad. But yeah, so we moved from Northwest Ohio, where I remember I did a glyphosate test on my kid. He was really young. He was 4, and it's a urine glyphosate test, and he was getting all organic, like really healthy, and he wasn't super picky eater yet, so he ate what I gave him.
Hmm.
So this was like a true test. And he still had toxic levels of glyphosate in his urine because it's in the rain, it's in everything. And
Yeah.
like, especially in Northwest Ohio, because you look out and it's just farm fields of GMO crops everywhere. And so we moved to or mid Tennessee, we're east of Nashville. And now it's just, you see, instead of GMO fields, you see like cows, and I love it. It makes me so happy. But, we had to get away from that. I told my husband, I'm like, there is just so much glyphosate being sprayed here. And I'm not talking about just your neighbor spraying their weeds with glyphosate. I'm just talking about like GMO fields for miles in Ohio. And I would see it affect my patients' health. Northwest Ohio, my patients there, their gut health is way more sensitive to patients in other states or other parts of Ohio. Really crazy to see. But that glyphosate, it's like basically poking holes in their gut lining, which is only one cell thick, the size of a tennis court, and just really inflamed. I would even correlate some of my patients, like I had a patient in Graves in remission, and right after they sprayed the fields, because she lives right by a field, and they would stay inside and shut their windows, but can only do so much, and her Graves will go back in remission when that glyphosate's there. So it's like now we're trying to do preventative things like binders and colostrum and stuff to help prevent a flare during this farming season. So
Well,
yeah.
hopefully the people that are hearing this will stop buying foods that have been grown on the standard, whatever agricultural method America allows to call standard health.
Right. Yeah. And I should give some examples of that. So corn is a big GMO crop, high fructose corn syrup for sure. So don't buy anything with high fructose corn syrup. You wouldn't find organic high fructose corn syrup anywhere. So just, that, but if you see something, especially if it's corn or soy, those are big GMO crops, alfalfa.
Well, as is wheat and chickpeas and lentils. Go figure. Why?
Oh yeah, those are those they spray the glyphosate on it to like dry out the crops as a desiccant. Yeah. Right. So if you see those kind of crops, a lot of grains, if you see grains, you want to get them organic. And that's kind of, when you buy organic, yes, it's a little more expensive, but you're also telling those big companies, we're telling them what we want. And we have seen a big shift. I remember, this is so nerdy, but not nerdy, but I guess we just got excited about it. So the Costco, I don't know if any people are big Costco shoppers out there. I have 4 kids, so we are. There are these little crackers that were gluten-free, because we're gluten-free, called Crunch Masters. And my daughter loved them. And I'm like, oh, I don't really like to buy them because they have sunflower oil in them, which is a seed oil. So that's going to be, more likely to oxidize and cause free radicals in your body, a lot of omega-6s. So they replaced it with olive oil, which I was like, that's impressive. So now I'm okay buying it for a cracker if they need them. So just read the labels. That's the big thing. They will try to put seed oils into stuff as fillers or, conventional wheat or gluten. So really reading the labels and trying to get the least toxic burden as you can with your food and your environment. Because if you work on that part, it's going to help your hormones and give you happy hormones. And I actually have a whole section in my book on how to clean your environment and what to look for and why and how it affects our hormones.
It's awesome. Do you want to just list a few chapters that you cover in the whole book, just so people get an idea?
Yeah. So one was the environment. So we're going to talk about just simple swaps in your kitchen, and also talk about mold and mycotoxins and why or who should be concerned about that, how to make your home a better place for the mycotoxins. We're going to talk about supplements, so different supplements and peptides to help through perimenopause and why and what they would do. We have a section on liver health and how you break down your hormones. So I think it's really important when we talk about our hormones that we understand how they're broken down, why they're there, why they're important, because then when we start connecting the dots, you're going to make better choices. You're going to understand why you're doing stuff. Because if I just told you, hey, like take this out of your diet or stop using plastic in the microwave, it's just, you're not going to start that habit just because someone's telling you that. But if you know why you're doing it and it has a purpose that serves your hormones and your health and your happiness, that's important. And another big part of my book is the faith aspect. So I have a devotional in there, and I also talk about what we should be doing with our spiritual environment. So a lot of the times I have found that women in perimenopause, there's a big spiritual aspect too, where we can get confused or attacked, and that can just make everything worse. And it's a big piece of the puzzle too for women going through perimenopause, because it is such a change. It's a big change and transition we're going through.
Yeah. All right. Big picture thinking. Remember, the power of your wallet is immense.
Yeah.
Whatever you spend money on will be replaced.
Mm.
Only buy stuff that's worth having. Right?
Yeah.
Well, and here's an example. That book. Where do people get it?
Yes. So you can go to drjenbook.com, and then Healthy by Dr. Jen is also my website and blog. But if you go to Dr. Jen Book, that should give you all the information on where to get the book. And if you want to connect on social media, I hang out mainly on Instagram at Integrative Dr. Mom. And also I have a YouTube if you want to go there. And you're on the YouTube for a podcast there, so you can see a familiar face.
Indeed. All right. So what have I not asked you that I should have? What do you think?
I don't know. Well, we were talking a lot about chickens earlier, so you didn't.
Yeah, that was our pre-interview. Okay, sure. Healthy eggs.
Yeah,
well, non-hormonal meats.
Yeah, it's quite an adventure here because we have a mini farm in Tennessee. So it's hilarious because me and the kids, trying to get these chickens, and we had a few fatalities, and my kids tease me about it. But farm life, you will have some fatalities. But like even just last night, we thought we had all the chickens in the coop, and we came back from church, and there were 2 stragglers, and we got them in. And then this morning, one of our, they're called silver Lakenfelders. They're very independent chickens. It just came down from a tree it was roosting at. I'm like, oh, hi. You didn't want to go in the coop last night? And I'm like, I'm glad you didn't get eaten. We have a lot of predators out here. We have bobcats, coyotes, foxes, red-tailed hawks. So it's an adventure, but it's been fun. And this was the egg from today. They're so pretty. But so we'll see.
Yeah. I have a line. The most revolutionary thing you can do now is to grow your own food.
Yeah. Yep. Yeah. You were trying to talk me into goat meat. So we'll see. We'll see about that.
Well, they're awesome lawnmowers.
Right.
You can milk them. You don't have to eat them if you don't want to. But anyway, more people on the planet eat goat meat than cow meat.
Yeah, maybe I don't know what we'll do. It's so hard for me, honestly, because I get attached to animals, because we got 2 turkeys because they were at the feed store, and my kids wanted them, and they get along with chickens well. And my son even named his turkey Dinner Time. And this Dinner Time turkey, he's so sweet. He's the sweetest, gentlest bird. And he's just started strutting with his feathers, and it's so pretty. And I'm like, we can't eat him. So I don't know. I don't know if we'll get attached to every animal and then we won't be able to eat it. So that's another thing that we have to figure out. But I love this Dinner Time. He's so cute. He goes, he just started doing that. He's the sweetest bird too. And he thinks he's a chicken. He just so funny. But yeah, maybe we'll look into goats a little more. I'm taking it slow and steady.
Right. The doctor going farmer. Well,
but here's the thing. I mean, if your doctor is burnt out, doesn't have any hobbies, doesn't eat healthy, on a bunch of drugs, they're not going to help you. So, you want to look for a doctor that isn't burnout, that is raising good children, is raising maybe chickens, because then they'll know how to help you. if I didn't have peace, how would I help other people? So I think, and that's what the book is about too. It's about ultimate health. So yeah.
That's really awesome.
Yeah.
All right. So drjenbook.com. Go there. It's available now.
Yeah. By the time this is going, it should be good. Yes.
Awesome.
Thank you, Martin.
Yeah, no, thank you for spending the time. I think it's super enlightening. Just getting grounded, getting your hands in dirt, touch grass, walk barefoot, do the stuff that we were supposed to do.
Yeah.
All right.
My son was cleaning out the chicken coop. He just did it on his own. He's like, I want to rake it. And I'm like, okay. Because he was seeing me cleaning up a little bit. So so model what you want your kids to do. And we'll make the world a better place. That's the point. Like you said, you put your money where it's going to do that also.
Mm-hmm. All right. Thank you. So this has been Dr. Jen Pfleghaar, Doctor of Osteopathy, on Life Enthusiast Health Shots. My name is Martin Patella, and you'll find us at life-enthusiast.com. Thank you so much.